Hi, everyone, and welcome to our first Global Brigades podcast. My name is Teresa Rodriguez. I'm a program associate formerly based out of Honduras. Today, we touch on a topic we receive the most questions about from volunteers, the sustainability of the work we do as an organization. Volunteers go on a brigade that takes place over the course of a week, but how do we, as an organization, keep the momentum going after brigade is over? The E100 is at the core of our organization's approach to sustainable international development. And here to discuss our sustainable programming model and the Empowered 100 is our Empowered 100 project manager, Tess Niehoff. Tess Niehoff has a degree from the University of Maryland in civil engineering and recently got her MBA. Congratulations, Tess.
Hey everyone, thanks Teresa.
So I wanted to start us at ground zero, so to speak. Merriam-Webster defined empowerment as having the knowledge, confidence, means, or ability to do things or make decisions for oneself. But how does Global Brigades as an organization define empowerment?
So I think for GB and in the E100 project, it's really all about making sure that people have the tools to do the change and to create the change that they want to see in their own communities. So on the end of students, making sure that students have kind of their own tools to inspire community members, also inspire other students on their chapters, people that may donate to their brigade, and for community members, right, really taking that time for them to understand what their community can look like and the change that they themselves are able to create.
Amazing. So take us through, I suppose, the community's empowered journey. What does the first step look like?
So the first step is really having a solid partnership. So making sure that the community is really engaged. Typically the community has to come to us for us to kind of embark on this empowerment journey. And then we start with meeting with community leaders, also doing some different initial assessments such as our rapid needs assessment that really helps us with that idea of what this journey is going to look like, what the roadmap will look like. And so really kind of diving into the first official step after we collect that data is the first medical brigade.
So what is the significance of a first medical brigade for a community?
So this first medical brigade is really kind of the ultimate trust, the ultimate leap of faith kind of between Global Brigades and that community. And maybe students are thinking, GB runs hundreds of medical brigades a year. How is this like one of the main building blocks? But especially for a community that's never had a medical brigade before, it really is kind of that, almost that olive branch, right? That kind of poco a poco, as we say in Spanish, right? Little by little trust building, making sure that the community understands what Global Brigade is all about and the support that we're going to give them, as well as what their own journey may look like, as well as on our end, making sure that the community is ready to really be engaged with what we're going to teach, engaged with making this change happen. This is a pretty long road, and this can sometimes be like 5 or 10 years. So we have to make sure that the communities that we do partner with are communities that are really willing to kind of take that next step and are really going to be engaged in different community councils, different leadership opportunities, and ultimately really being partners with us in the projects that we run.
Wow, it sounds like the work on the community's end as well as the volunteers.
Yeah, it is. It's equally for as much work as volunteers put into brigades. Definitely, it's as much work on the community end of making sure that they're engaged with the projects that we're putting forward and helping them with, and really helping them kind of take the next step.
So now I kind of want to circle back to the root of the question. How do we, as an organization, as Global Brigades, build on the work of volunteers after a brigade or a medical brigade?
Yeah, so this really is the roadmap. So, we might start with this medical brigade, and this is definitely kind of the first bridge that we hurdle with the community. And afterward, we really bolster that with a lot of community education. So in some communities, that's going to look like training CHWs. After that, perhaps starting to train the CAHA with financial education, and starting that legal establishment process. But really kind of those first few solid steps are making sure that community members receive education to make sure that they understand what different community committees are about, understanding the various projects that we're going to embark on, and really making sure that those foundations are there. I'd say after that, the next hurdle or the next bridge that a community passes through is definitely the water project with a community.
So how does a community engage in a water project?
So community members really do a lot of the work that we do on a water project. So the first thing, right, helping the engineering brigade, forming kind of an interim community water council to help engineering brigades map out the communities. And then after that, after they have the design for their water system, reaching out to local partners such as municipalities, as well as kind of getting those initial steps done for a long-term water project. As we then dive into the water project, that community water council is responsible for things like collecting the water fee, working with community members to create a work schedule for each and every family, and really doing, a lot of that kind of either grunt work or a lot of that, even the physical work, the digging. A lot of times, brigades definitely supplement that and help community members continue that fight, continue that drive to want to, dig trenches every day. But a lot of times community members do have to dig those trenches by themselves, even when students aren't there, to finish their water project within 3 to 4 months. So, right, trying to, and preparing the community as well for the groups of volunteers that we'll have in community. The water council really takes on a lot of that responsibility, and so that really represents the next bridge that a community has to get to. And that's really critical to the leadership skills that they're forming, to the administration skills that they're forming, because the next project that we take on is the public health project with pre-savings.
So after a few of these hurdles, we finally arrived at pre-savings for public health. Can you talk to us more about what that looks like?
Yeah, so this is where both community bank members, sometimes members of the water committee, and sometimes members of the basic sanitation committee or public health committee, they will work hand in hand with the CAHA to help community members save up over time for a hygiene station. So that way community members then have access to a private place where they can take care of basic sanitation, whether that's just using the toilet or using the shower or, washing their hands, washing dishes, that they have one basic place that they can take care of those needs. Also for Honduras, we do pre-savings for eco stoves as well, which helps cut down on respiratory illness. And so during this time, community members, and especially members of both the CAHA and the Public Health Committee, are really in charge of making sure that community members are progressing on their pre-savings, and then also in some cases collecting the money on behalf of Global Brigades, which then they'll follow up and give to a technician where we'll help the community track that. But usually either the bank holds the money or one of our own public health technicians will hold the money in the interim time while they're completing that savings. And sometimes that process can take up, sometimes it's a year, sometimes it's anywhere from 6 months to about 1.5 years that it might take a community to save that money. So that's definitely another bridge that we have to cross on this journey.
Wow. So I'm sensing kind of a trend that we're moving through the holistic model on our journey to empowerment. Would I be correct in assuming our next step is financial literacy?
Yeah. So kind of through this whole process, every time we take a hurdle, every time we cross this bridge, we're also backing it up with a lot of community education. So definitely financial training, financial literacy, making sure that everybody really has kind of a say in how this community is developing, both in terms of physical things like water systems or public health units, but also kind of those softer skills, right? Whether it's the community health workers or the bank, business brigades at this point starting to consult with local businesses to really kind of foster that entrepreneurship, also foster kind of that financial literacy within the community so people understand how they can continue this growth once GB leaves. And that kind of takes us on to our kind of, this isn't so much of a bridge, so much as kind of a continued learning process, and that's definitely with healthcare professional access, which is kind of one of our final goals that we have in a community, and making sure that communities have sustainable healthcare access once we no longer are running medical brigades in the community. And typically what we do there is engage with local doctors that will go out and sell medications or consult directly to the community. So now that the community has the skills to be able to save money for emergency needs, or save money for, those monthly needs that they might need to take care of. So that might be blood pressure medication for an elderly member of their household, or diabetes medication. But they're able to look at their finances and kind of think about it on a monthly basis and think, okay, these are the things that I might need money for. I might need to be able to pay my water bill. I might be able to need to pay for this medication or a doctor's consult. And then we help the community with being able to provide that doctor's consult. So that's kind of one of almost the last curve that we're going around kind of on this roadmap.
So at this point, is a community finished with their empowerment journey, or are there some additional steps that they still need to take?
So they're definitely approaching the end, but I would say the one final thing is definitely the process of legal empowerment and making sure that they have access to legal services within their community. A lot of times this is provided via our legal empowerment brigades, but in other cases this is also provided by on the ground staff that we might have, various legal assessors that we have kind of in each community, different relationships that we have with volunteer lawyers within the various countries that we work, where we're able to extend these legal services to things like the Water Council or public health committees or the community bank. So that way we can make sure that when people need legal services within the community, that they're able to access those. And that pretty much wraps up our empowerment journey. So definitely not the end of the development of a community, but at that point, kind of our job as Global Brigades is done. The community has the tools that they need to continue this process, to be able to, if they need a water system down the road, for example, they have a water committee in place. They've been collecting water fees over time, so they should have cash to be able to make those improvements. The same thing with public health, right? They kind of have this methodology. They have access to capital through their community bank. So if they want to take out a loan, for example, to build another hygiene station or another eco-stove, they should be able to kind of access that additional money that they may need along the way as well.
If you had to summarize the E100, the Empowered 100, in sort of measurable objectives, what would that look like?
Great question. So there are 6 objectives for an empowered community. The first one is having regular affordable access to a healthcare professional medication. The second one is having daily access to trained community health workers. The third, having access to a water system with a trained water committee in place. 4, having majority coverage of public health systems in a community. Goal number 5, having access to affordable credit and a trained community bank in place. And then goal number 6, having at least 1.5% growth in a community as measured through savings data, kind of over a 5-year period.
Wow, thank you so much, Tess, for giving us the rundown of the E100.
Thank you. I hope I explained everything okay.
You did. So I wanted to sort of end on a more personal note. I wanted to ask you, because I'm sure a lot of our volunteers are looking to get into either international work or international development, any sort of sustainable programming. And I wanted to ask you, how does your previous experience, whether it be academic or experience in the workforce, lend itself to developing the E100 programming and coordinating your goals across all involved program countries?
Yes, so this is definitely a tough question. In my own experience, so I came to the E100 project as kind of a background in WASH, right? So WASH and project management. I had worked for another NGO previous to Global Brigades. I also had some experience in the formal construction sector, so being able to take those skills of project management and then kind of enhance that as I got my MBA over the last 2 years to be able to approach this. And I think an important thing, right, no matter what set of skills you have, always being creative and always looking at challenges in a creative mindset, I think that's maybe that's one thing that I definitely took out of engineering school, was always kind of taking a creative approach to problem solving. And really, right, like as you spend time in rural communities, right, whether that's in the context of a brigade, whether you've volunteered in some other capacity along the way, but being able to listen, and being able to listen to the solutions that more often than not, community members have for their own development, and kind of the solutions that they can bring to the table, and then figuring out ways that we as an NGO or nonprofit organization can really kind of bring those solutions to fruition, and really just help help and critique a community's development journey along the way.
Do you have any sort of ending advice for anyone looking to break into the NGO sector?
I will say the NGO, especially living abroad, as you know, living in Honduras, there's sometimes you can feel like you really have limited options. But to anyone who's interested in diving into the NGO sector or living abroad, I would just definitely take some time to reflect on what you're passionate about and what skill sets you bring to the table. Take some time to think about that, and then try to find organizations that align with that, trying to find opportunities where you can really grow that passion while living abroad. Definitely, there's a ton of career sites that can help with that. Idealist definitely has a lot of postings. DevX are different resources that I've used along the way. But always just kind of seeing what your own passions are, and then being able to use those to really help out others.
Awesome. Thank you so much.
Thank you.
So this has been our Global Brigades podcast. Thank you guys for joining us and listening. And let us know if you like this across our social media. Have a good day.